It's my pleasure to introduce the next speaker, who I consider a personal friend, and glad that she was able to come and be with us today. Dr. Kimberlydawn Wisdom needs no introduction to many in this audience. She's been a figure within both state government for a number of years, and certainly now at the Henry Ford Health System. She was Michigan's Surgeon General for the period 2003 through 2010. We got to know her very well at that time. She's Senior Vice President for Community Health and Equity and Chief Wellness Officer at Henry Ford Health System, which is a very important leadership position. Does work at the University of Michigan Medical Center, is an emergency physician by training, and more importantly, she grew up in Mystic, Connecticut. And for those who saw the movie Mystic Pizza, this is what it's all about. So with that, Dr. Kimberlydawn Wisdom. Thank you.
Mystic Pizza. I haven't heard that in a little while. Thank you so much, Rick, for that very kind introduction, and I'm just absolutely delighted to be here with you today and see such a full room to address such an important topic. If you see me kind of fooling around a little bit, I've got readers now I think I'm supposed to be using, so I bring the case up. I don't even know what to do. Do I put them in my pocket? What do I do? So I may have to identify some of my more seasoned colleagues and say, how do I work these things? So if I need them, I'm just going to put them on. I guess that's how it works, right? So I also want to acknowledge the other presenters that will be presenting today, and especially Dr. Anda, who I just met for the first time today, but I certainly know about the outstanding work that he has done with other colleagues across the country, and I'm just so thrilled that he is here to help launch this major event and really help us drive this initiative across the state, which I think is absolutely so key. I'd also like to recognize policymakers in the room, and I see Lisa Liss, who's been one of our major policymakers, but I know at the local, your local communities, the state level, the national level, our policymakers are so key, whether they're in the legislature or whether they're making policy within organizations and institutions. Those policymakers are just so key, and I want to acknowledge them, and also really acknowledge all of you who are advocates for children and family in some form or fashion. And your role is so important, and the whether you're really on the front line doing really grassroots work or whether you're in more, other positions, because I even think grassroots people are still very significant leaders. But no matter where you fall in that spectrum, your work is so important in order to really deliver on what needs to be done to improve the health and well-being of our children. I want to applaud the efforts of creating healing communities. I just thought that was just such a great title. The healing aspect, addressing adverse childhood experiences, but also delighted to hear that you all have been funded by the Michigan Health Endowment Fund. And that's a competitive process. I'm fortunate that we have received a grant also. So that, I think, really, to have this funded by the Michigan Health Endowment Fund really deserves a round of applause. I think that's really major and very significant. But I appreciate the fact when you talk about creating healing communities, that creating word kind of gives an element of it's a journey. It's not something that you're going to create and then leave and put on a shelf or say we did it, check the box. It really connotes the whole aspect of it's going to be an ongoing journey. It will involve multiple sectors of our community. It will involve multiple stakeholders within the community, and it will also involve the community's involvement in a very deep and significant way, and also to collaborate in ways that are innovative. And I underscore the word innovative because I think we need to continue to find really different ways of approaching our communities and really in order to help them improve their health and well-being. Our children are the most precious and important resource that we have in this state. And I just think the more focused, the more of a bright light that we can shine on our children, the better we'll be. And it's interesting, it's when you raise up the issue around children, it's like it doesn't matter what side of the aisle you're on or what discipline you're from. everybody wants to embrace the health and well-being of children. That's just so wonderful. You know, when I served as Surgeon General, we wrote a prescription for a healthier Michigan that in part was very much focused on protecting children and families. And I see some people shaking their heads, so I know you've been around a little while if you're shaking your head and can remember that. But I regret actually that the prescription didn't include ACEs. And I was like, wow, what were we thinking? Why didn't we include that? We did know something about it, but why didn't we include that? Realizing that traumatic exposure that dramatically increases the risk of, for 7 out of 10 of the leading causes of death in this country, why didn't we include that? Or how profound the social determinants of health are in really improving community health. We also have subsequently learned since that time that health occurs not in the doctor's office, not in the emergency department, but health really occurs where we live, learn, work, play, and pray. And the Robert Wood Johnson Foundation has given us a lot of guidance around that. So I think we're evolving, and this ACEs initiative certainly is indicative of that evolutionary process. We did engage during, when I served as Surgeon General, a focus on children, whether it was Generation with Promise or working on childhood-led poisoning prevention or whether looking at infant mortality reduction. We tried to move upstream, but with this ACEs initiative, we are truly even moving more upstream. And I think that is what is so fabulous and so important about this effort. Also, while doing the work at the state, it became even clearer and clearer that by and large we deliver healthy babies in our communities across the state, yet between the womb and that time that they're due to walk across the stage as a graduate, some really bad things happen to many children. And how can we mitigate that? They're born at a place where they can be productive and fulfilled and successful and major contributing individuals to our society. Yet, what happens in that space? And we're responsible. Those children are not the ones that are responsible for their health and well-being during those formative years. And learning that trauma that indeed gets under the skin and changes the biology and changes the trajectory of their lives, which is so key. And changes it oftentimes forever. And some of the work that we do, we're always trying to move them to another trajectory, but that's oftentimes a heavy lift. And many have contended that the greatest threat to the public health today is adverse childhood experiences, the greatest threat. A quote by Nelson Mandela said, "There can be no keener revelation of a society's soul than the way in which it treats its children." I'd just like to elaborate that on a bit. The way we treat our children will dictate how we need to treat them as adults, and I mean medical treatment. When we talk about cost, how we treat them and how we care for them is going to dictate how we may have to treat them from a medical perspective. Much of the work that will need to be done will need to be transformational. So we, not incremental and let's do the best we can, but truly look at how we can be on the more of the transformational end of the continuum. At Henry Ford Health System, our vision is transforming lives and communities through health and wellness, one person at a time. And I ask each of my team members, you've got to memorize it, and we have a little mantra every morning. But transformational is the key operative word, and it's based on the premise that as we know more, we're really called and required to indeed do more. As we have more and more evidence, we need to respond to that in a deliberate, systematic, and sustainable way, and I underscore that word sustainable. I was just glad to hear about creating healthy communities, and Rick told me, it's part of a social movement. I mean, this isn't a program, this isn't a project, this isn't an initiative. This is actually a social movement. So since I'm not a social movement expert, I had to sort of, look it up and see what social movement, how you describe that. And some social movements, you advocate for change, and some social movements resist change. But the characteristics that I saw in reading one of the theories of social movement, where there needs to be a need, there needs to be a feeling of deserving better, I think that's definitely there, and believe that conventional methods are just not quite working. And I think we're probably in agreement that that is where we stand, and that we what we're doing from a medical perspective is just not enough. While clearly, like I said, I'm not a social movement expert, all the elements are here, and I want to do everything that I can, and my role in whatever capacity at the national level, at the state level, at the local level to help drive this social movement. In 2011, when we launched our infant mortality work in the city of Detroit, we had 4 major health systems involved because we saw about 150 to 200 babies die per year in the city of Detroit. 4 health systems involved, local and state health departments, academia involved, as well as community-based organizations. And we were kind of told the infant mortality problem is kind of intractable because the women that are affected by poor birth outcomes, it's because of stresses that they experienced when they were still in their mother's womb. So unless you can go way back 18, 20, 25 years, you can't change that. Well, we felt, no, that's just unacceptable. We just have to break that myth or thinking, and it's scientifically based in many respects. So we were able to develop something called Sew Up the Safety Net for Women and Children, ultimately Women's Inspired Neighborhood Network, where we engage community health workers as the change agents that link women to communities and women to services. And of the 323 women that we had in the program, and that was a program, but now we have a movement moving, 323 women, we had 0 infant deaths. 0. Thank you. And these are women from very underserved neighborhoods that should have experienced multiple infant deaths. So our approach has been one of trying to be transformational by involving community health workers, different provider types. At Henry Ford Health System, we didn't employ community health workers until just several years ago. That was not a model that we use. So we try to be transformational. We try to be transcending by involving social media and doing what the young people reaching them in ways that they can well receive the information through social media, and we try to translate for our providers, because many providers don't fully understand what women are experiencing and why they need to be very involved in their care, in women's care at even a deeper level. And also Chris Priest, who I know is leading our Medicaid area, I've been involved very much in the national campaign to prevent teen and unplanned pregnancy, and he was a person 10 years ago that helped me to get on that committee to serve. But I say that to say that at all levels, I want to be here to support this major movement. So as I get ready to close, social movements entail shared ideas, organization, leadership, resources. I think you have some element, I know you have some element of all of that there. And the only social movement that I can remember that I was very involved in was with, when I was 14, 15, 16, with Dorothy Height. Actually, I was in Mystic, Connecticut, but went and picketed the national YWCA because of some unfair practices. And it was about diversity, it was about equity, and now those words are common words. We see it in all kinds of settings, in healthcare, in communities. So what's key about a movement is it's got to move towards sustainability. And I think that's what's key. And I have no doubt that with this kind of group in a room and these kinds of groups across the state, major leadership of the steering committee, but major leadership, and I'm looking at you all right here, this can be truly a transformational effort. So I want to salute you and know that I'll be a champion for you all in any way that I possibly can. And I know we're going to not only be the first state, but we're going to be the leading state around this to drive down these adverse experiences our children experience and really truly have a healed community. Thank you so much.